Good morning. Good morning, everyone, and welcome to the Department of Family and Support Services Coordinated Response to Domestic Violence in a Healthcare Setting. The release date was July 29th, 2026, and the due date for this RFP is August 26th at noon Central Time. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we'll respond to your questions at the midpoint and end of the presentation. Please also use that question box to notify us of any technical issues. This webinar is being recorded. And anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by the Department of Family and Support Services. The purpose of this webinar is to provide information for the solicitation. We will also provide a copy of the recording on the DFSS YouTube channel with the links to the recording, and a PDF of the PowerPoint slides will also be posted to the DFSS webpage under the Alerts and/or Funding Opportunities tabs. Please give this 5 business days to upload. DFSS retains the right to share a list of registrants to this webinar, along with their contact and organizational information at our discretion. As for the agenda, we want to start off with introducing the GBV team.
Sorry, had a problem coming off audio. Hello. Good morning. My name is Adriana Camarda. I am the Senior Director over the Division on Gender-Based Violence here at DFSS. I am joined not only by Jillian Black from our Contracts Division, I am joined by Yesenia Galvan, our Project Manager here at our DGBV Division, and Lizzie Meyer, our Program Coordinator, who will be working on this program. Over this presentation and webinar, as Jillian said, the agenda will be going over the purpose of the RFP, a little bit of background information about why the RFP was released, information and scope of the program description, and then we'll be going over the selection criteria and how your program application will be scored. And then I will turn it back to, after that to Jillian to talk about the timeline, technical assistance for applicants using the e-procurement system, and questions. I think right after I present all of my information and the selection criteria, we'll take any programmatic questions if that's okay with you, Jillian, at that time.
Yes, that's fine.
Because there are quite a few on the line, so that way we can address your program questions before we go into our lovely e-procurement system. The purpose of the RFP. The Division on Gender-Based Violence has released this RFP in one instance prior to this release and has been operating or administering this program for 2 years. The purpose or the original intent of this program was to intervene with survivors of domestic violence in a healthcare setting and do an earlier intervention with some screening done by the medical emergency room or medical center staff, and then connecting that individual, that survivor, to an advocate so we could earlier intervene than them reaching out to an advocate after their healthcare stay. So the original purpose of this was, again, early intervention, training hospital staff on how to do screening for survivors, and then connecting them to an advocate to help support them prior to their release from the medical system. Next slide. So a little bit of background on the prior RFP. DGBV released this in August of 2022, based on extensive feedback and design from the Gender-Based Violence Task Force, the Mayor's Task Force on Domestic Violence and Gender-Based Violence, in hopes to designing a program that would create earlier intervention for survivors who are being seen by medical centers and medical clinics around the city, prior to another police incident or reoccurrence of violence. The program started in 2024 and has shown pretty good success on early intervention with survivors and gaining access to an advocate prior to release from the medical center. One of the big lessons learned that we learned along with the provider of this program is that having a strong healthcare partner, and what I mean by a strong healthcare partner is one who is incentivized, not only to have staff trained in the emergency department and other places in the medical center, for screening, but also a two-way relationship where the advocates have some space in the medical center or easier access because they are a gained partner with the medical center, and really having buy-in from both organizations. In 2026, DGBV again sought feedback. The reason why we are coming back out in RFP is because of the contract period, the shorter contract period of the DVCR, what we call it, the DV coordinated response, to seek feedback again from community stakeholders if they still wanted this program and thought there was success in this program and it was a best practice, and is there a continued need for this type of service. We received positive feedback that not only was this program needed and early intervention was working in the healthcare setting, but it is a priority and a critical access point for survivors who wouldn't otherwise engage or know that there are domestic violence services in the community. Next slide. So this is the overall goals we intend to have with this program. The first one is having increased identification of survivors or increased or better school screening tools in a medical center where an advocate necessarily would not have had access to be looking for or having been there to engage with survivors. And in order to have better screening and increased identification of survivors, the key to this program is really in that strong relationship and partnership with the healthcare center to allow advocates, allow a DV organization to come in and train the medical staff and train them on what GBV is, how to recognize the signs, and how to provide resources, right? And giving them resources and access to how to address this issue before that survivor leaves the medical center. We hope that by this strong partnership and these strong training criteria that we can, or just program that we can provide the healthcare partner, will increase or improve the partnership like a two-way street, right? And improve survivor safety in the long run and having them or have an earlier intervention at the healthcare setting rather than being released and having a risk of being experience violence again. And then finally, we're hoping that the overall goal is to support survivors achieve long-term stability and long-term access to supportive services if they need it, being engaged to a community-based survivor outside of the hospital. Next slide. So in the RFP, you will read a little bit about the current state of domestic violence, not only in Chicago, but how it is a critical public health issue for healthcare providers seeing survivors in the hospital. Healthcare settings tend to be the first place that survivors seek help, and having the right screening or having the right knowledge within the medical emergency staff or medical center staff to know where the access points are, how to connect them to an advocate is crucial. A lot of survivors are not always identified in this space and time when they're in the emergency center or in the medical center. And so as a result, we miss out on an opportunity to tell them not only what their rights are, but how to access these services after they're gone. So priorities for improvement with this program is that really we start with the healthy partnership that we have with the healthcare setting and training the staff on how to key in on and screen in a way that's not intrusive to the participant, to the survivor, to the patient, on if they're experiencing or they have experienced violence, then that was a result of their injuries. how to build a strong referral pathway. Not only, like I said, this is a two-way street. If you come in and train the organization, they're more likely to refer if they're positively screening and they're seeing some benefits in screening out some patients that have connected to an advocate. And then expand access to culturally responsive trauma-informed services. So the healthcare center, not only are they better improved to screen and identify what GBV is, but also understand and provide more trauma-informed services even when they're doing the screening. And then, of course, we're DFSS. We're always looking to use data from these programs to drive continuous improvement, as you advocates and your organizations are as well. Thank you. Next slide. So for this RFP, we have laid out in the RFP specific target populations that we are hoping to serve and address with this program. First and foremost, this program is for domestic violence survivors in a healthcare setting. That is the definition of that is under the Illinois Domestic Violence Act, which includes not only intimate partner violence, but it could include other types of non-IPV, non-intimate partner violence. So it could be roommates, it could be relatives, family members, friends who have had a sort of domestic incident, and it could also be caretaker and caregiver, so type of abuse that has landed the patient into the emergency room. So we are using the IDVA definition. So if there is in the training with the healthcare provider, they need to also understand or be taught that there could be domestic violence even in non-IPV. And then the rest of the target population, we understand that women are disproportionately impacted by domestic violence, of course, but we are also looking at other type of target populations like male survivors, LGBTQ survivors, and other subpopulations, specifically those with maybe immigration or language or cultural differences, uninsured survivors, low-income survivors, as well as survivors with disabilities. There's just some of the type of subpopulations that we hope to reach with this RFP. And then we go on in the RFP to talk about the 10 most violent communities for survivors in the city of Chicago. So we are really looking for a program that is working or in partnership with a medical center or medical clinic that is serving people from these communities. We understand that there are only really 5 emergency rooms or maybe 10 in the city, and that they're not all or may not all be located in these communities, but that if you can show in your application that the survivors that they're treating are coming from these organizations, that satisfies the target population and geography requirement. Next slide. So in the RFP on pages 8 through 9, as we have provided for you, we lay out what DFSS is looking for and requirements for the program. And we would like to take this like backwards from 5 to 4 on this slide. Of course, like I said, we are, DGBV, we're always data driven on looking at, delegate data to make sure that there is not room for improvement or room for improving services to survivors. So that is always going to be a program requirement in data collection and data analysis. The second thing I said that sort of is really crucial and important to this RFP is how you propose to train and get access to the staff in either an emergency center or a medical clinic so that they understand what DV and gender-based violence is. How do they screen for it with trauma-informed lens? And how do they refer? What is their pathway to refer to the entity that is going to provide services? And then, of course, in order to do that, you have to create for them or develop a risk and lethality assessment that they would be using in the emergency room or clinic so that they know what is the risk for the survivor in getting exposed again to more violence if there's no intervention. And then obviously the advocate can come in and do either on-site crisis response and advocacy and connect them to case management and ongoing support after they have been discharged from the clinic or their emergency room. Next slide. So having done those program requirements, here are the performance goals and outcomes that we're looking for. from this program. One, obviously, the screening portion of the goals. We want to make sure that there's actually the healthcare staff after being trained. We're obviously looking to see how much training is conducted, but after the training, are they actually identifying survivors and referring them to your agency? And then how is the survivor engagement um in, after the advocate engages with them? Are they accepting services either with your agency or another agency? Again, that gets to the intervention. Are you providing advocacy and supportive services, either telling them how they can pursue an OP or how to do safety planning with them and things like that? And if they've connected to case management or ongoing case management, have they developed a service plan and are they meeting their goals? Is also an outcome that we are very much interested in to show that earlier intervention and supportive services has allowed them to get to better outcomes, either through service plan achievement or increased safety. You can find all of these performance goals and outcomes on pages 10 and 11 of the RFP that goes into more detail about them. Next slide. Finally, we come to the selection criteria. The selection criteria in the RFP will give you specifically the breakout of how DFSS reviewers are scoring your proposal. It is divided into 5 areas, one of them being community involvement. We score them based on 100 points. You can find all of the selection criteria on page 4 to 15 of the RFP. Community involvement is 30 points out of 100, so it's a significant portion of your points, and we will ask you 5 questions. The 5 questions are based on the 5 bullet points that you see here, and you will be asked to describe how your program knows or describes the community that you're serving, whether that be in the emergency room that you're working with or medical clinic that you're working with, and what community areas that clinic or that emergency center is serving. How are you better equipped to serve survivors effectively? Meaning, do you have language access? Do you have partnerships? Do you have staff to able to run and operate this program? And then how do you gather feedback, not only from the clients, right, with the survivor survey, but also from the staff that you're training at the medical center or the medical clinic? Then we are looking to whether you can demonstrate a commitment to equity within your organization and out. Are you promoting diversity, equity, and inclusion within your staff? Do they reflect the community that you're serving? And finally, do you have experience in high-need communities, specifically probably the 10 community areas that we have outlined in the RFP? So this section, again, is worth 30 points divided into these 5 questions. And then the next section is organizational capacity. Organizational capacity is worth 15 points, which is a little bit less than community involvement, and divided into 3 questions that you see here. Do you have the right staffing? Meaning, have staff that is 40-hour trained, either in DV or SA? And how do you recruit and how do you fill vacancy positions? Do you have strong financial systems to not only be able to work on a reimbursement basis, but also track and separate expenses for your various grants? And finally, how do you effectively collect and manage data, which is important to us? You can find, again, these questions on 14 and 15 of the RFP. The next or third selection criteria is on the next slide. Strength of the proposed program. Strength of the proposed program is worth 35 out of 100 points. So this is a significant point area and questions that you'll be asked, divided in only 4 questions. One being, obviously, describe your program, and we mean describe it at length within the character limits. How you will provide, how you will meet the needs of the survivors, and how you will achieve the program goals, including that partnership with your healthcare provider and your referral pathway. How do you use evidence-based or best practices to execute this program in the DV models or in providing case management services? How do you demonstrate a strong partnership with your healthcare provider or in your MOU? How is the coordination of this training? How is the referral pathway? And how is the coordination of services going to work? We want you to describe that to us in this section. And then finally, demonstrate your strong partnership with either an existing MOU or letters of support and or a timeline. So by submitting a final timeline to finalize the MOU if you're working with a new healthcare partner. Um, that MOU or that timeline, or in this section, you should clearly define what the roles are between your organization and the healthcare provider, what the responsibilities of both staff are, and how you're going to coordinate the service. Next slide. The fourth selection criteria is performance management and outcomes. This section is worth 10 points. This is where you describe to us in prior programs that are either similar or like this program or not, but your regular programs, how do you collect data and show evidence of strong program performance? Use your data. Actually tell us your data in your previous programs on how you achieved those performance goals and how you had outcomes for your target population, whether they be DV or some other form of GBV. How do you use your data to improve your programming? It could be explaining how you identified challenges or identified program improvements by looking at your data or even looking at your feedback. And then tell us how that change actually strengthened your service delivery. Many agencies or many proposals don't always follow through and tell us how the change actually impacted for the positive or negative, and just tell us that you use that data to make a move and what you learned from it. And then finally, demonstrate your ability to how you collect, analyze, and use this disaggregated data to identify equitable service or improve program. Also tell us the staff that you have available to do that analysis. And then finally, the last selection criteria is your budget. Here we divide this into two questions, basically, how you can demonstrate that your agency can work on a reimbursement basis, and did you submit a budget that is reasonable considering what you said and laid out in your program proposal, whether that's the staffing or the other costs associated with running this program. So those are the 5 areas of how we are scoring your application laid out in points. I'm sorry I didn't give out the budget section is worth 10 points as well. So having gone over those selection criterias, there are some attachments that we can't award points for if they are not submitted, obviously, or we're using to score you in those 5 selection areas. The first one, and these are not in any sort of order or by criteria or mandatory, but the first check mark you see here are any reports, studies, or documentation that you have that demonstrates your performance and your results. Some organizations do end of the year reports. We would be willing to look at those if you attach those, but they're not mandatory, as long as you've described your performance in the performance section. The next one are resumes for key staff overseeing the program. These are mandatory. We would like to see resumes. If you don't have existing staff, the job descriptions or both, on the staffing that is going to be charged to this budget and this program. We also want to see certifications if you have them for either DV training, gender-based violence training, or any type of training. The next mandatory attachment is the budget itself. We cannot score your application if there's no budget attached, regardless of whether you put in a question how much you're seeking. We need a breakdown of the budget. And finally, or the fourth item is the current MOU or your timeline to get an MOU with your healthcare partner. This is crucial and mandatory to this RFP only. And we would like to see it as an attachment to the RFP. And then finally, any program requirements that are addressed in full. So if we are seeking, like we said, resumes and job descriptions, we want to see if you don't have those, what's your policy on hiring or what's your strategy on hiring? Thank you. Next slide. The evaluation process. The evaluation process, like I said, we will go over the 5 areas on the strengths of your proposals and score them out of 100 points and the responsiveness to the selection, how responsive you are to the question. Thank you. My light goes off. All right, I'm sorry. Valuation process. We will be looking at your applications, or the scorers will be looking and evaluating your responses based on the points that we've assigned questions and how either your attachments or your responses address those questions. Failure to submit a complete proposal, meaning all of the attachments, or not responding fully to all of the required questions, may subject your application to rejection. The fourth one, even after our review, our commissioner has the funding authority and has the right to either reject, deny, or deny our recommendations for funding for your application. And then finally, DFSS reserves the right to ensure that all mandated services are available citywide, meaning we are also looking to make sure that you've met or are serving most of the community areas that we have laid out in the RFP. Next slide. And finally, so we're having this pre-proposal webinar today, August 6th. You have had an opportunity to look at the RFP for, I believe, a week since it's been released. We will take any written questions or emailed questions until August 10th, close of business. The reason why we're setting a deadline is that we will print a Q&A with the RFP, answering all of those questions in writing. The application is due noon, that's 12 p.m. on August 26th, which is a Wednesday. Jillian will go over why you do not want to wait until August 26th to even start entering information from another document into the application. You want to be able to put all of your items into e-procurement prior to that date. If you do not meet that noon cutoff, the e-procurement system will close and nothing will be saved. So if you don't get to the certification part that Jillian has referred to in her slides, I have had agencies who have been working up to the minute and they don't reach that submission point, that the e-procurement system will close. And there is nothing that the city, DFSS, or DGBV can do about that because of the strict procurement rules. We will not be able to accept even a half application, and we will not be able to accept your printed application. Those would violate all procurement rules. And then next, the program period, the contracting period for this RFP is January 1 through December 31st of 2029. That is a 3-year contract, which is longer than our previous program. And there are I believe, 2 1-year extension renewals in that. So meaning this could be up to 5 years. Okay, next slide. Just an overview of the funding and the contract information. Our funding is through corporate funds that we received from the city budget. Our anticipated annual funding, this is what DGBV has been anticipated will be able to allocate to this program. If we receive level funding or more funding than we did in previous budget years, we may be able to increase this, but this is the maximum that we can contract. Our initial contract term, I've just discussed, is from January of this upcoming year to 2029. There are 2 potential 1-year extensions before we have to go back out to RFP. This is a reimbursement only contract. There will be no advances. And I said these are corporate funds. We are looking to fund 1 agency. Other tips, when you submit your budget to this proposal, please submit a full 1 year's worth or 12 months of a budget. When you submit your budget, you can exceed or request more than the $450,000. But that, like I said, that is the maximum we can award if we have constraints. If we receive additional funds, we might consider your request. So my advice to you is always request what your actual budget program costs are, knowing that this may be our maximum, because sometimes it may not be our maximum. And so we generally, if we don't ask for more than the $450,000 and we do have more money, it's very limited that we can give you more money or more funding. So I always say, use a reasonable budget and ask for what you really need. And also follow all the rules in the budget submission, including explanation and cost categories. All right, next slide. Also, here's some budget tips. When we see budgets, always check your calculations. Don't forget supplies. Supplies are eligible under this this contract. Client assistance is also eligible if you're working with, survivors in crisis at the hospital. Think about reasonable costs on providing them client assistance, like gift cards or other things that they may need. Make sure all of your job descriptions on the budget have a resume and a job description that you have uploaded as well, so we know the jobs that you're paying for, even if they're administrative positions. Also put a brief description of the job, just requirements in the budget itself so we can know which ones you're talking about, and put your budget in the appropriate column, meaning your request versus any sort of share or match that you are putting in. All right, this is where I will hand it over to Jillian. I just want to reiterate that the applications are due at noon on August 26th. And at this point, we'll take any questions you have so far on the program itself. And now you will look like you're talking to somebody who's not a ghost.
I don't see any questions at this time. There will be another opportunity for questions to be answered towards the end of the presentation.
Okay, and if I may also add, if you don't want to ask your question now and you want to put it in writing before the August 10th deadline, feel free to email me. My email is at the top of the deck of this deck, and also in the RFP itself.
On the title page.
Yep. And if it's too hard to spell, I acknowledge there are a lot of A's in my name and the placement is sometimes tricky. You can also email dfss-dgbv@cityofchicago.org.
Oh, I see a question just popped up.
Okay. What kind of supplies are allowable? They could be any type of supplies, administrative supply, notebooks, laptops for the advocates that are responding to the situation. Oh, the question went away. Also kinds of supplies that are allowable, not necessarily supplies. I want to mention there's also transportation allowed either between the staff who have to show up in person or in the client assistance if the participant needs an Uber or if the participant needs transit, that's also an allowable expense. And Yesenia has answered the other question. Does it necessitate co-location? Which co-location is not necessary. We understand in a healthcare setting, an emergency room, there will not be space for you. We get that. All right.
All right.
I'll be here if there's questions at the end.
At this time, we're going to move forward with application tips. And our most important application tip that we can provide is to start your application yesterday. Also, and save it as often as you can as you're working on your application. If you have never done business with the city of Chicago, please register into iSupplier as soon as possible. Review RFP narratives and application questions closely as they align with the scope and the selection criteria. Please use the information in your RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuation and spaces. Each response is allotted 4,000 characters. Again, please try not to use the back button on your browser. You could potentially lose your work. And again, we can't stress it enough to start your application as early as possible. Some tips for working in e-procurement. To submit multiple applications for a single RFP, applicants will need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. You can submit your application and later amend it up until the due date of August 26th at 12 noon. However, we strongly encourage you all to avoid the rush and possible mishaps by submitting your application early. And plan on submission taking approximately 30 to 60 minutes. Again, we cannot stress it enough that late applications cannot be accepted. And we can also not accept applications via email. Please, for assistance, please make use of the e-procurement hotline for assistance at 312-744-4357. It also can be reached via email at customersupport@cityofchicago.org. As far as the hotline, it operates during business hours only, which is Monday through Friday, 9 a.m. to 5 p.m. Again, we encourage you all to submit your application early and save it as often as you can as you're working on your application. As far as agency requirements, we require agencies to provide articles of incorporation and any amended articles of incorporation. We also require an IRS affirmation letter. Please note that the IRS affirmation letter is for not-for-profit agencies only, and that the letter must be dated within 60 days of your submission. You can obtain this letter by calling the IRS directly at 1-877-829-5500. However, if you are a for-profit agency, please submit your original letter from the IRS showing your FEIN number. The UEI number is required in addition to the central contractor registration, which can be provided on the entity overview page on the sam.gov website. And lastly, a certificate of good standing letter with the state of Illinois is required. We have a labor peace agreement ordinance, which applies to all DFSS and CDPH delegates that have 20 or more employees working for their organization. The only exemptions are hospitals. The contractor must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. You may ask, what is a labor peace agreement? A labor peace agreement is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation, and in return, they will not strike or stop work in a way that will impact human services. For technical assistance, on the DFSS webpage, there is a link to the RFP as well as training documents. Please see the alerts section on our website. For agencies, for questions on registration and e-procurement technical assistance for delegate agencies, please.
I'm gonna beat her now.
For questions on registration and e-procurement technical assistance for delegate agencies, please reach out to customer support at cityofchicago.org, and as well as the hotline. The number is here on the screen. We also have training materials, which includes documents and videos on the cityofchicago.org website under online training materials. At this time, we're gonna go into how to enter your responses and accepting any amendments. Step 1, for entering your response, you must select create quote from the drop-down menu in the actions box, and then you click on go. And this will take you to the application page where you can get started. If the RFP you are interested in has been amended, in this case it will be, you will need to acknowledge and accept that amendment to start or submit your response. So to accept the amendment, you must click on View Amendment History, which will be at the top of the screen. To begin acceptance and the acknowledgement process, follow these steps after clicking View Amendment History. First, you click on the document number. Next, you click on the infinity or eyeglass icon to review the amended changes to the RFP. And then you click on Acknowledge Amendments button to acknowledge receipt and understanding of the changes to proceed. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP, as well as any Q&As attached in the amendment. When you get to this screen, you click on the I accept checkbox, and then you click on Acknowledge. Then you click on Yes to indicate that you confirm your acknowledgement of the amendment. Finally, you click on the checkbox that you accept the terms and conditions, and then you click on Accept to accept them. And that is the final step in acknowledging and accepting the amendment. Now, when you accept the amendment, you can then move forward with submitting your application, which we'll go through now. So when you are ready to submit, meaning that you've attached all required documents, you've answered all required questions in full, you start by saving your draft one last time and clicking continue. If you are missing information, you will be given an error message at the top of the page, similar to what you see here. And the error message usually directs to something left undone in the application. So in the last example, the error message indicated that the lines found under the Lines tab had not been completed. In the example listed here, the error is about an unanswered question in the application or requirement section. The quote value refers to your, in this case, missing answer. So once your application is free from errors, you are then ready to proceed and submit. And by clicking continue, it should put your application into the review and submit phase. When you get to this screen, this is like a summary page, and this is also your last chance to review all of your data and to confirm that everything is accurate. So please use that opportunity to check your attachments, scroll down to the bottom of the screen to see all of your responses. And at the very bottom of the screen, you will be asked to provide an electronic signature. So please be sure to fill in the signature before checking the box. You can then submit your application. So once your application is submitted, you'll know because you'll receive a submission confirmation screen similar to what you see here. And the e-procurement system will also send a confirmation email within 24 hours of your submission. However, if you have not received that confirmation email within 24 hours of your submission, please feel free to email me if you desire confirmation prior to then. My name is Jillian Black. My email is jillian.black@cityofchicago.org. And at this time, we're going to open it up again for more questions. And I see that we have about 5.
We do. So we're going to answer these live.
Okay.
Thank you, Jillian, for going over e-procurement. If any of you have any questions on e-procurement, you can also list them here. I highly recommend you download this deck when it's available and use it. Those screenshots are very helpful during the application process. All right, we'll go through the first question. What funds or grants are available for victims, including transportation? Outside of this grant, we're talking about this grant, you can budget for client assistance, if that's what you mean. And client assistance, you would have to list that out in your budget, but anything within reason is allowable. For example, transportation. The other question is whether it can pay for healthcare, including medication follow-up and treatments. It can. I don't know if at the time of the discharge whether the survivor is getting any sort of bills for treatments, but in the ongoing case management, you can budget for healthcare costs that are within reasons. There is no cap for the gift card. However, again, within this budget, it has to be a reasonable part of your budget, right? And you do have to log them and really show and demonstrate to the fiscal auditor that the client received a gift card for whatever it is that you said in your budget. So if you said for, for let's say furniture, you can't just submit, a voucher to Amazon without showing that it was for a piece of furniture, if that makes sense. So gift cards are usually a little bit restricted when it comes to the audit side, but as long as you're tracking them, you can include them in your budget. And then, are there any healthcare centers approved for this grant? We do not identify what health center that you want to propose working with. You can propose to work with any health center, large or small. If you want to do an MOU with a community clinics, you can. It doesn't have to be an emergency room per se. It could be community clinics as well, or urgent cares or things like that nature. But all of the program requirements have to be there, including the training and the two-way referral. So you have your choice of what health center you want to work with.
Thank you, Adriana.
Mhm.
And if you have any questions after the webinar, there is still time to ask those questions. I believe the question deadline is Monday, August 10th at 5 p.m. Those questions can be sent to Adriana. Her information, contact information is on the screen. And for any more non-programmatic questions, if you're having any issues with e-procurement, those can be sent to the e-procurement hotline. Their email and number is on the screen. And you can also reach out to me. I'll help in any way I can. My information is on the screen.
We have one more question before we close. I'm sorry, I didn't scroll down, Jillian. Um, there are specific forms to fill out for the services or the reporting platform. So we actually collect in DGBD reports that are in an Excel spreadsheet, and we would also anticipate that the agency may have to eventually enter data into InfoNet, which is the statewide database. Currently, we are only working on the Excel spreadsheet because it may be only a one-time interaction where um, not enough information for InfoNet is collected, but those would be the two forms of reports or systems of reporting that we would use.
Again, the question deadline is Monday, August 10th at 5 p.m. Before we close out, Adriana, is there anything you want to add?
No, I want to thank everybody for participating and asking these really good questions, and Jillian for going through the e-procurement system, which I know can sometimes be a barrier for some agencies. Thank you.
Thank you all for attending our webinar. Good luck with your responses and enjoy the rest of your day. Thank you.
Thank you.